Hi, my name is Danielle Catani, and I'm going to be your nurse today. Hand hygiene. And we're going to go ahead and get an IV started on you. The doctor said that you need some rehydration and some antibiotics. So what we're going to do is we're going to start an IV on you, and I just wanted to find out if you had any questions of that, or for that. And then I also wanted to confirm your name, which is
IV
needed.
needed.
Oh,
IV
sorry,
needed.
guys.
IV needed.
Yes. And your medical record number?
121212.
Yes. And are you allergic to any medications?
Yes, I'm allergic to penicillin and latex.
Okay, perfect. Okay, and I have our MAR right here that I will be referring to. And I'm going to go ahead and gather my supplies on this little table. While I'm doing this, I wanted to make sure that I went over the 6 rights of medication, which are the right patient, right medication, right route, right time, the right dose, and the right documentation. And then before I do this, I'm going to go ahead and we'll shut the curtain around us so that you can have a little bit of privacy. And so today, the first thing we're going to do is we're going to go ahead and start your IV so we can get you rehydrated. And I'm going to go ahead and get tape out just in case my my Sure Sight doesn't work. Okay, I have my alcohol prep pads. I have my tourniquet, which I'm going to go ahead and apply onto the patient so I can check the what vein I would like to use. And I went ahead and found a good vein, which is going to be right here.
I'm going to go ahead and undo it.
Not yet.
Okay.
So then I'm going to go ahead and undo the tourniquet while I get the rest of my things ready. I have an extra needle just in case something happens. I'm going to go ahead and open my needle. I'm going to loosen the hub. Actually, I'll wait and do that. I have a pen. Got my IV flush. Have an extra lock just in case. I'm gonna go ahead and open this lock.
Sorry.
Alright, trash over there. Alright, and then I'm going to go ahead and open up I have a 10 drop. So I'm going to be administering the first order, which is IV 0.9% normal saline. The patient's going to be receiving 1,000 milliliters over the next 6 hours for rehydration. And if I calculate that out with my 10 drip, then I'm going to be giving 167 milliliters per hour, which is going to calculate out to 28 drops per minute. So I have my bag. I'm gonna go ahead and hang it. And I'm gonna get my tubing, and I'm going to pull off the little cap thing. Remove the cap off the spike, close my roller. I'm actually going to pull my roller up to the top so it's not just hanging around. Alright, I'm gonna clamp it down. Thank you. And then I'm gonna go ahead and spike the bag here. And I'm gonna fill the drip chamber about halfway. And then I'm gonna go ahead and take the tubing and I'm going to flush it to remove all the air.
You take that cap off.
I'm just gonna wait for a second because I didn't know if you could take the cap off. I mean,
Yeah.
I did, but. Okay, so we have our IV bag ready to remove it.
Oh, it's up to you, whatever.
All right, I'm gonna go ahead and remove the cap. Actually, no, I'm not. I'm gonna leave the cap on.
Okay. Thank you.
Okay, so I'm going to go ahead and push my innards of the table back in so that I have better room. I've already created a med label for it, and I actually have a med bag label for it. And then I also have the tubing label on the bottom. I'm not gonna tear it off because it won't stick. But I'm gonna go ahead and just put this on the bag. All right, so now that I have everything ready and I have my patient all set, I'm gonna go ahead and I'm gonna put my gloves on first. Thick gloves. All right, we're gonna put our tourniquet on. Did you turn it on yet or no?
Nope. Do you want me to?
Yeah.
Okay. I think it's going.
Okay, so now we're ready. I'm gonna go ahead and feel for the vein. I'm gonna start this right here and I'm gonna try to prop it up. Actually, I guess I could just do this one. Actually, we should let the blood fill up before we tourniquet it. Sorry, it's a fake arm. Okay, that's better. All right, so tourniquet's back on. I'm gonna go ahead and clean the site in a circular motion, working from inward out. I'm gonna go ahead and let that dry. While it's drying, I'm going to uncap my needle. I'm gonna loosen the hub. Bevel side up. And then I'm going to go ahead and pull the vein a little bit down so that I can do it. I'm going to access it at about a 10 to 15 degree angle. These gloves don't fit me. At about a 10 to 15 angle. And I got a flash, so I'm gonna go ahead and lower the level, and then I'm going to advance the catheter in. I'm going to hold pressure down, and I'm going to remove the needle. Sorry for the bleeding. I'm gonna take the tourniquet off. That's just lovely. We're bleeding. All right, so now I've got the I'm gonna clean up a little bit so it doesn't look like a hack job. And I know I normally wouldn't do that unless I was holding it stable. I'm gonna make sure that we'll put the sharps in the container. And I'm gonna go ahead and flush it with normal saline, getting the water out first, or the air out first. And then I'm gonna go ahead and put it on. I'm gonna draw back a little bit just to make sure I'm still in the vein, which I am. And then I'm gonna go ahead and administer the flush. And I'm going to date and initial the little sure sight thing. And and then I would take that off on the other side, but it's really hard to take off. So now we have our peripheral IV established, and the patient is going to be receiving his next medication order, which is antibiotics. Patient's going to be receiving clafuran, and that will be the next video.